Dr. Jim, who is a chiropractic here at EH Medical as well. So my background is pediatrics. Before I came here, I worked in the primary care setting, and in that setting I did a lot of physicals of children. And one of the things that I would run into at that job would be questions regarding chiropractic care in the pediatric population. So I have Dr. Jim here for a Q&A to go over some of the questions that I heard as a provider with some answers for you guys as parents. So my first question is chiropractic safe in kids?
Research have shown that chiropractic is not only safe for kids, it's one of the safest healthcare profession in the world, which is why malpractice for chiropractors are like the lowest of any healthcare provider in the world. So that should tell us right there from that perspective that we're the safest profession. Number two, because chiropractic is all natural, does not involve hardcore drugs or does not involve hard procedures done on the body that involves cutting or different things like that. Again, there's no chance of infection, there's no chance of really breaking anything. So yeah, chiropractic is the safest things, not only for kids, but also for adults from a standpoint of healthcare, for sure.
Okay. And how old can kids be who come into the office? What ages do you see?
Yeah, so we've seen babies as old as 5 minutes old, and we have seen obviously kids all the way up to 18 years old. So if you don't mind, I'd like to incorporate in that why kids come to see us at different age like this. So the reason we sometimes see kids right after birth is because the birth process is very traumatic, as you know from a mom perspective, but sometimes for the baby. With all the turning and the tugging and the pulling of the baby's head, we sometimes, there's misalignments being created right from the birth process. So I recommend every single parent to have their kids checked very, very early on in age, just to make sure that the birth process did not create misalignments of the spine affecting the nervous system that can create problems, developing problems in kids. And then every time a kid has a major fall, whether it's off a bike, whether it's off of tumbling down the stairs, falling off a bunk bed, or God knows what kids do out there, yeah, it's great to go to the ER, check to make sure there's no broken bone. 100% on board with that. But okay, now there's no broken bone. What about the alignment of the joints? What about the long-term effects of leaving something out of alignment? So we highly recommend that kids get checked every time they have a major fall, just to make sure that everything is still accurate. Another thing I want to bring up too is scoliosis is affecting like 5 or 6% of the population according to different research paper. In other different papers, it says that scoliosis can affect up to 30% of the population in the kids. And that's always overlooked because you can't see it with your naked eye, what's happening inside the body. For the mild scoliosis, you can only see the major scoliosis.
So parents would ask, isn't that screening being done in schools?
Absolutely. The screenings are done in schools. They're done by qualified nurses and or medical providers. The problem with scoliosis is you cannot see it with your naked eye. So I can look at someone from the back and say, yeah, it looks relatively straight. However, there's already a 10-degree or 15-degree scoliosis that I will never be able to see with my own eyes. Same with the other medical professionals. So yeah, we miss a lot of those just naked eye type screenings that we do in schools and different providers' offices. So again, we cannot replace an x-ray determining all that stuff, or looking at other things besides just the spine with your naked eye, like looking at why is there a shoulder higher than the other? Why is there a leg that appears longer than the other? And that can give us indication that there's something else behind that. And that's where doing x-rays come in to see how bad things are.
So would x-rays be dangerous in kids?
X-rays are no more dangerous than being in front of your microwave. Research have shown that being in front of your microwave while something is cooking is the equivalent of one x-ray. So x-rays are not damaging in low quantity. They're actually good for us clinicians to find out really what the source of the problem is.
So if I was looking for a chiropractor for my child and is there any way I can request not to do x-rays? Can you adjust a child without x-rays?
We definitely can adjust child without x-rays because we obviously do an exam on every single child that comes in. But as soon as we suspect that there could be curvature of the spine, whether it's scoliosis from this direction, or maybe we see a head forward posture on a kid, that will then lead us to think, instead of having a proper curve in the neck, maybe we're having a straightening of the curve, or like a reverse curve in the neck, which could be very damaging to the spinal cord and the nervous system. Then we would obviously take spot x-rays in the areas that we are concerned about.
So you really need it for chiropractic to be able to work on them and know exactly what you're working with.
So usually infants all the way up to the age of 3 or so without major trauma, we usually don't need x-rays or anything like that. But once we have a history of a lot of trauma and different health condition, and we start seeing the high shoulder and the head forward posture, then yeah, you would need, it would be in the best interest of the moms, the dads, the patient, the child patient, to have those x-rays to see exactly what's going on. And then that makes my life easier, because if I know exactly what's wrong, then I can actually correct the problems that we're dealing with. So it's not, so I hope I answered your question properly. It's not a blanket statement, we're gonna take x-rays on every kid, but yeah, if you had problems, it does help, and it makes our job a lot easier and better.
And I think also it allows you to track the progress too of you can measure it. It's a measurable objective finding that you're able to measure and see exactly what work you're doing.
Obviously, especially if we're dealing with the beginning stage of a scoliosis, which usually happens in a 3, 4, 5 years of age range, then we can establish a baseline study of what's going on. And I don't know if most people know this, but scoliosis is a progressive condition. It gets worse over time. So if you don't catch it early, and you catch it in a later stage when it's a lot worse, we've got limitation as to what we can do and not do at that point.
So speaking of that, if a child has severe scoliosis,
yes,
what would chiropractic do for that child?
Well, if we're dealing with a very severe scoliosis, unfortunately chiropractic might not be able to do anything because it's too far gone. However, the other side of the coin to scoliosis is they progressively get worse over time. So with our system of care here at Elevation Health Medical, we can stop the progression of those scoliosis and make sure they don't get any worse. And we are also able to manage a lot of those patient's symptoms with what we do to make their life a lot easier and better and increase their function.
What about if it's only mild or moderate?
And if it's mild or moderate, in a lot of cases, we're able to reduce the scoliosis. And again, not only increase function, but also increase their health status and function in the body, and avoid, again, future progression of those problems.
Yeah. And I think what you said too, it's so important to catch it early while they're still growing, because children are malleable. We're able to mold them more, and the bones stick a little bit better than when they're adults. Lastly, will it hurt?
Will it hurt? Yeah, it's a good question. I get that all the time. Most of the time, and I can't give you a percentage, but I'm going to say it's in the high 90s. Most of the time, not only does it not hurt for children, but as you hear in the office a lot, children will laugh because we tickle them. Not that we literally tickle them, but the adjustments kind of feels like I'm tickling them as a perception of how it feels. Yeah. So
great.
There you go.
Well, thank you. I hope this resolved any misconceptions or answered questions. Feel free to come to our office, have a screening, have a consult. We can talk more about scoliosis if you're interested, or any other childhood musculoskeletal issues that we can help you with.